So we have some questions here in no particular order. So the first one, does polycystic ovarian syndrome have any effect on lamb? So for those who don't know, polycystic ovarian syndrome is a problem where the hypothalamus, that little gland in the brain that Steve Hammes was talking to that produced LF and FSH, if you can cast your mind back an hour, becomes dysregulated, and it stimulates the ovaries to behave in an abnormal way. They develop cysts, and it changes the metabolism of the sex steroids in the ovary. And so an unusual situation happens. They produce more androgens, more male hormones. So women with polycystic ovary syndrome tend to become slightly more hirsute. And have other changes in their skin. They have problems with fertility. They also then get slightly elevated estrogen levels as well under certain circumstances. So polycystic ovary syndrome is incredibly common and affects about 5 to 10% of women of childbearing age. And whether it's related to lamb or not, no one knows. Clearly, if there was an increased level of estrogen, as you've heard a few times today now, that might be a bad thing for lamb. Whether the having polycystic ovaries has a significant impact on lamb, we don't know. I don't think any of us that work in the field really recognise that people with this problem have a particularly bad form of lamb at all. I mean, there's no research on this. So as far as polycystic ovary syndrome goes, it's pretty common. We don't think it's relevant to lamb particularly, although there are some theoretical links there. Do you want to do the next one?
Are there any side effects to rapamycin? Can one purchase the drug in the USA? Do you need a prescription? Is it transferable to the USA? And then there's a second question. Well, the rapamycin. Yes, I mean, there are side effects to rapamycin, as many of you will know. Rapamycin is sirolimus. Mouth ulcers, an increase in cholesterol can occur. Remind me, the high blood pressure may rise a bit.
And you can also get proteinuria, a leak of protein through the kidneys. So we usually monitor all of these things: cholesterol, urinary protein, various other side effects. Lots of people get a little bit of edema, ankle swelling, or sometimes a bit of diarrhea. Everybody usually gets something. They're usually things that are annoying, but not too dangerous. In the longer term, the side effects are less well categorised, because I think the record for being on sirolimus is about 9 years now. And so that's really as much as we know for lamb. Usually the side effects are manageable, and they usually get better the longer you've been on it. It seems, for reasons we don't completely understand.
You certainly need a prescription in this country to get the drug, and as we heard, it's not actually been approved by the Committee on Safety of Medicines, but I don't think there's been a problem in people getting it.
Not too much of a
it doesn't have to have been approved to get it. Can one purchase it in the USA? Well, again, I don't imagine you can purchase it across the counter, but it has been approved now last week or the week before by the Federal Drug Agency. So, yes, it is available, it is being used. I'm not sure what it means by transferable to the USA. I don't. I would think that would be difficult. I would think so. I think you'd be able to get it here if you were on the drug anyway. I'm sure you. I can't believe you would have any problems getting it here. And if you do, have a word with the man on my left here. Yes. Estrogen in food, chickens, etc. More common food, soya, any other, if at all. I guess the question is, is that something that patients with lamb should be aware of or doing anything about? I don't know.
Just for the background, a number of plants like soy have compounds in that act like estrogens. They're called phytoestrogens. Thanks. So if you eat a lot of soy, then you're probably increasing the estrogen content of your food, and as you probably know, some farming practices, they supplement animals with hormones to improve growth and things. Is that right, Charlotte? There's an oh, thank you. There's an expert in the room about this. But in practical terms, if you eat a mixed diet, I don't think you have to be very fastidious in avoiding soy or anything. It's probably not sensible to eat, to put as much soy in your diet as you can, which some people do tend to do. So I think if you eat a healthy mixed diet, that you don't really need to concern yourself too much with phytoestrogens or such things.
Do you want that?
Okay. Next question. Does chiropractic or osteopathy have any effect on lamb with a view to improving lung function? We don't think that does. There's never been a study of that that's been conducted scientifically. So I mean, it's not something we would recommend for lamb-related problems as such.
I think it's somebody who wants to have it for her back, or is planning to have it for her back.
Okay, well...
and the question is whether... I'm not sure just what's involved in having chiropractic on your back or for your back, but we may not be the best person to answer this.
It's probably not going to be harmful, but it probably wouldn't for your lungs, but it probably wouldn't be beneficial either.
The next question is a question for the audience, actually. Could we ask how many women have suffered from migraine with aura? And the question is whether this is connected to lamb in any way. Could we have a hands up, please, if you have migraine? Oh, well, let's have migraine on its own. 1, 2, 3, 4, 5, 6. Wait a minute. 1, 2, 3, 4, 5, 6, 7 people have migraine. And has that occurred since you developed lamb? Can you put your hand up again if it's since you developed lamb?
But you don't know when you got
Well,
lamb.
no, but I mean, if you'd had no.
So what we need to do here, so the women in the audience without lamb, can they put their hands up if they get migraines? See, it's pretty common.
Yes,
That's
I don't know what the prevalence of migraine is. Yes.
I mean, I think that pattern. I mean, it's a reasonably common problem. Just occasionally, women with lamb can get a benign growth in the brain, which can sometimes present with migraine, but that is very unusual. And most cases of migraine are just standard cases of migraine.
Do you want that one?
Okay. Can a lack of oxygen while pregnant affect the development of the baby? The answer to that would be possibly yes. So your baby is dependent on getting oxygen from your circulation, and so if your oxygen was low, then that might affect the development of the baby. I'm not quite sure of the background to this question, but usually if women with lamb are well enough to go through pregnancy and have a full-term pregnancy, then it's unlikely, I suppose, that their oxygen levels will be low enough to cause a significant problem. But certainly during delivery and those sorts of times, if there's reduction of oxygen to the baby can be a problem for its further development.
Because there are a lot of people who live at altitude who are live with a low oxygen level and have babies normally. So, I mean, it's not unnatural to have a low oxygen to a certain extent, but obviously if it's very severe, then that's a different matter. If a patient doesn't live in the Nottingham area, can she ask to be referred to one of the specialists here, e.g. from Hampshire?
Yep.
And who should she ask? Her consultant, GP, either?
Okay,
or?
so the Lamb Centre is funded by NHS England to look after anyone in the contract, which means in England, mostly people from Wales or for England and Scotland. So people from Wales can come and see us, but they have to get permission from Wales because Wales don't pay. But so basically anyone can come. Anyone from the EU can come by a reciprocal agreement. And in fact, we've also seen people from both North and Southern Ireland. And actually, so any doctor can refer you, your GP or your local hospital specialist.
So what would be the best thing to do? To take some information from here about the Lamb Centre so the GP has...
Okay, yeah, that's possible. Or the Lamb Centre has a website, and the method of making a referral, which is basically our address, is there. And there's an email which is lambcentre@nuh.nhs.uk, or if you just Google Lamb Centre Nottingham, then you'll find the page easily, and if you just write to us.
Does taking tamoxifen as a result of also having had breast cancer confer any benefit or any adverse effects on Lamb patients? I am now in the 6th year, and that's relevant to one thing that was said, the 6th year of a 10-year course.
Yes, they've all gone. I sort of went ooh when I read the question. So as you heard, tamoxifen is a slightly unusual drug. A lot of drugs will either completely block a receptor or they'll activate a receptor. Tamoxifen does a bit of both, so it's what's called a partial agonist. And the response of cells actually can evolve over time, as Steve Hammis outlined. I think there's not much experience of tamoxifen and Lamb. A very long time ago, a few people were tried on it for Lamb in a fairly ad hoc way, and there was clearly no obvious benefit. There wasn't an obvious adverse effect either, and we really don't know whether it affects it. The fact that so Steve, as you probably spotted, was American. And so they do things slightly differently there, and it sounds like the duration of treatment with tamoxifen is perhaps different in the States as well. I mean, the important thing is to have the best treatment for your breast cancer, and to keep an eye on your lung function, I think, in practical terms. And you could obviously discuss that. What your options are for drug treatment for breast cancer with your oncologist, and come to an arrangement about what's likely to be best for the breast cancer and your Lamb. And of course, it depends on how bad your breast cancer is, how bad your Lamb is, and lots of individual things. And if the person asking, goes back to their oncologist, I'd be very happy to talk to their oncologist, and if they wanted more information. Okay. This is not a question, but a thought. But just thought it important to mention the importance of regular smear tests for those on immunosuppressants due to the increased risk of cervical cancer. So I think this is a mention of perhaps rapamycin's main job in Lamb is to stop cell growth, as Debbie highlighted earlier. It does have some effects on the immune system to reduce the response to infections. What we're learning at the moment is actually what rapamycin does to the immune system is not actually it just doesn't work quite so well. It's a really quite complicated balance of reducing some things, but actually boosting other things. And people are talking about using rapamycin for problems usually associated with immune suppression, sort of specific problems, post-transplant lymphoma and other things, which are usually caused by viruses in immunosuppression. So that I think the point about being on rapamycin here is that although it may have an effect on your immune system, it's not necessarily to cause lots more infections, and not necessarily. The reason I'm talking about infections with cervical cancer is that cervical cancer is usually caused by a viral infection of the cervix, so that's at least one of the big factors. And I think the important point from this question really is not to forget about the rest of your health screening when you have LAM, and so things like cervical screening and I guess mammograms and blood pressure and all those other things remain important while you have LAM.
The last one's a bit of a horror story. In 2013, I was in hospital for 3 months, and I believe at that time the person had not got a diagnosis of LAM. During that time, I was admitted to intensive care due to a chest infection. My husband was called at 3:30 in the morning to say that because my lungs were shot, they would not attempt to resuscitate me. Is that the normal practice? We would only, etc. So, on instruction of a consultant. Yes, do you want to?
The reason why we done it wasn't like a clinical question, it was an emotional question, like,
Yes.
you know, because
Absolutely.
it was quite horrendous, and it was just really to highlight the situation out there that so many people don't know about LAM. And in my wife's case, it was a matter of life or death.
Yes.
The actual doctor in charge of the intensive care at that time told me that he wasn't going to resuscitate her, and he wouldn't put a tube down her if her lungs. And she did have LAM at that particular time. She was diagnosed with LAM.
Oh, she was. Sorry.
But they failed to notice it at that stage, and I thought it was. So that's why we've highlighted it. That how do you get it out there? But that they do know you've got LAM, and it's not just a shot lung. And you know, that's why we've done it. That's
Yes.
why we've highlighted that. Yeah.
Well, I mean, there are all sorts of things that went very badly wrong here, and I mean, apart from anything else, the fact that you're here today shows that the lungs were not that shot. And I mean, it can be very difficult to know when you've got somebody who's got a chest infection and they've been ill for a long time and they're in intensive care, just how much recovery you will get. But it needs a very, very careful appraisal, as judged by the fact that clearly, as I say, your lungs were not shot.
We actually sent a letter, you know, like highlight the whole thing way after.
Yes, but I mean, yes.
There's no apology, there's no sort of
Yes.
thing being said here. It just
But I mean, the other thing is the decision not to resuscitate should be a joint decision between you and the hospital staff. It certainly should not be done in the middle of the night. I mean, you know, I'm sorry, but you know, you were let down. Hopefully that's not been.
how do we go about putting it out to what can we do personally?
Well, I would hope it's a very rare event. I mean,
There's a lot more consideration of this now when people are admitted early to hospital and they try and make the decision in advance. So these sort of last minute things where somebody, you know, makes a decision that without the full information available, hopefully this doesn't happen. So I mean, there's been a move towards that now.
and it wouldn't just be LAM, of course. You know, it could be other conditions as well.
Could I just add something that I think it was very prevalent early on when LAM was first around and no one knew anything about it, that patients did carry around something from our a website or just a little piece of information. And I still think that's quite valuable because although when you go to the health services, more people now understand about LAM, that's still not a very big number. And I think for a lot of people, they're in a difficult position because you're requesting them to be professional and tell you how about your condition, and yet you probably know more about it. And if you can come with, and by that I mean either there's a fact sheet on the website that runs to about 8 pages. That's quite detailed, but there's a briefer little sheet. Even just having that so that you can cards as well that we did have. Yes. But so having some information
Hopefully
is helpful, just to be able to put that across. Yeah. Exactly. So in terms of practical things, I think that you know we can help ourselves by doing that, but hopefully we don't have to.
It's from Michaela Bradley, and she says, would it be possible to ask if you know how fast patients decline once stopping rapamycin, please?
Hello, Michaela, if you're watching. So the studies of rapamycin show that, and I showed the graph of this morning, is that people tend to be held steady in most cases when they take rapamycin. When they stop rapamycin, certainly what happened in the studies is people seem to return to the previous disease trajectory that they were on. So if they were deteriorating previously, they started doing that again. So some people need to stop rapamycin for various reasons. A small number of people just don't get on with it. They have sensitivities to the drug and it's just not the thing for them. Other people need to stop rapamycin if they get listed for an active lung transplant, because one of the things that happens with rapamycin when you is it does affect wound healing, and the transplant services are quite worried about recovery from the procedure if there's rapamycin around. And because it stays in the system for a long time, we tend to stop the drug when people go onto the active list. And certainly that's a practice of UK transplant centres at the moment. There is some talk actually at the moment in the States as to whether that's strictly necessary because of the concern that underlies this question. So what I haven't seen in anybody who stopped rapamycin, either because they didn't get on with it or because they got onto the active transplant list, that the disease has suddenly flared up, rebounded, or taken on a really sort of got a lot worse suddenly. It's hard to say exactly what happened, but I think the way I view it is that it's as if people hadn't been on the drug before, so they might go back to their previous disease course. I hope that answers your question. But at the moment, it does seem necessary to withhold rapamycin while you're waiting for a transplant, if that's the issue.
Are there other questions in the audience? Sally, wait. Hang on.
Run down to Holland Barrett and buy some.
So that's a sort of tricky one. The other place, I don't know whether I should say this or not. The other place that has a lot of that is wine, of course, red wine. Red, it has to be red. The problem with that is you do need to take a reasonably big dose to be effective. So with a food, I'm talking about a food supplement now. I wish I hadn't started this. It's like a lot of these things. So there are a lot of drugs that might help at the moment. Statins, stuff that you can actually get or talk your doctor into giving you. Metformin, which is a diabetes drug, has a theoretical benefit, and there's a trial of that in tuberous sclerosis. So there's a few things like this around, none of which have been tested in humans. if you're on rapamycin, should you take resveratrol as well? We don't know if that's a safe thing to do. It certainly has theoretical benefits. I wouldn't recommend that anybody did that now. But I'm imagining that there will be a study, because there's quite a lot of wind behind the Marina Holtz's work. And also it's important for breast cancer, the interaction between that pathway and breast cancer biology. So I think we'll probably learn more about that in the coming years. I mean, I am a bit conservative about, saying, oh, you should try this, you should try that. You might get a different answer from other people, but that's my view. I don't know what you think, Anne.
No, I mean, I agree. There was good. Well, it looked as though doxycycline might work, but it didn't, and so I wouldn't be in a hurry to take any of the ones that are being suggested. But I think, if you happen to need a statin or something, then not to to be reasonably happy that it should help, if anything. But who knows?
Yeah, the reason we agree is because Anne trained me in all this.
Well, first of all, I don't mean to be disrespectful, but do you vet the questions that come out of the box? Or
No.
No. Because mine doesn't seem to have come out, so can I ask it now?
Oh, you sent one in?
Yes, I had two actually. I mean, on the same piece of paper, but it's not. I mean, it wasn't controversial or anything.
Oh, right.
I can't see why it might have been banned. Because John put it in, I've been saying, are you sure you didn't put it in with the questionnaires?
I think that's a genuine accident.
Yeah, well, okay, so I shall ask. If it's time for the second one, but the first one's sort of the more important, I suppose. From being on Lamline, I've noticed that quite a lot of us seem to have acid reflux. And I'm wondering, is there a correlation between having LAM and developing acid reflux, or is the correlation between being on sirolimus and developing acid reflux?
I don't know.
So I haven't seen an association with LAM and reflux. Reflux is a really big thing in respiratory medicine at the moment, particularly in the pulmonary fibrosis world. Pulmonary fibrosis is a disease where collagen scar tissue builds up on the lung gradually, and it has a much more rapid and aggressive disease course than LAM on average. But patients with pulmonary fibrosis are very prone to getting reflux and acid getting into the lungs. In fact, people even think that reflux might contribute to the disease. Probably reflux occurs when food comes out of your stomach the wrong way up your esophagus. Now, if your diaphragm's keeping the pressure high in your abdominal cavity, you're more prone to getting reflux. So that's a possibility. As you've alluded to, some things give you the symptoms. So anything that causes inflammation in your gut, or certainly the upper part of your gut, might cause reflux. I haven't noticed.
Can we have a show?
Yeah. So let's do it. Let's do a scientific experiment. So first of all, the control group is women with LAM who aren't on sirolimus. Who gets reflux? So a couple, 1.5. Okay, so you go as a yes. So yeah. And so, okay, so. I mean, reflux is a relatively common problem anyway. And now women on sirolimus who get reflux. So that's more, isn't it? Okay, so maybe there is something in that.
We did something on landline. So landline, the question was raised and it became quite obvious. It seemed like more than anecdotal evidence that there was a lot of people with this problem.
Oh, that's very interesting. Okay. Yeah. Oh, that's very interesting. Actually, we're just thinking about writing up the side effects of sirolimus in the series that we've got, and Pachaya, who's sitting there, has been earmarked to do that. So maybe we should. I mean, I have to say, I don't really ask people about reflux symptoms because it hadn't been on my. I don't go on Lamline for my own safety, but. I mean, maybe we should start asking about that, perhaps.
And you had a second question.
Yes, it's just well, hopefully a quick one. I've been on Seretide since 2003, so that's now 12 years, and I've just been diagnosed as having ocular hypertension. I didn't have any symptoms of it. I only went to get new glasses. So is there a link? Because I read all the side effects of everything I'm on, and the only thing I can find is that Seretide could lead to some amount of hypertension, and I can't remember whether it said in the eyes or not, but could there be a link? It's the only steroids I'm on.
Well, Seretide is a mixture of a beta agonist and a steroid. You give beta blockers for ocular hypertension, so I suppose in theory the beta agonist wouldn't be helpful, but actually I think because you take it in the lung, the dose is so low, and I've never heard of it, the beta agonist, causing any problem with the eye. Inhaled steroids, there is some, sorry, I'm thinking back now, a long time. There is a bit of evidence. I'd have to just check it, that I suppose, again, it's a dose-related thing. If you take a small dose, then it probably is okay. If you're on a larger dose, it may just be a factor.
I was taken off one of my inhalers it's a while ago, so like I say, it's long. Was there a Becla Forte?
There
a
was.
Brown one?
Yes, there still is, I think.
I was taken off that because of slight ocular hypertension and put on a different one, and that seemed to do it. So.
Well, Becla Forte was a high dose,
as
you'd guess, from the name. Yeah.
Yes. A long time ago.
Yes. I mean, again, it's a question of balancing. It may be that you could take beta blocker eye drops and they work and still get the benefit to your lungs. And if you need the Seretide for your lungs, it's balancing one against the other.